Hi, I'm Dr. Christopher Palmer. I'm a specialist in robotic total joint replacement surgery. Symptoms patients may have with hip arthritis, number one would be groin pain. Sometimes it'll radiate down towards their knee, rarely past their knee. Some patients will have pain on the side of their leg. Rotation of the leg can be very painful. Getting up and out of a chair, stepping to the side, maybe getting in and out of your car can be painful. And then any sort of prolonged walking. If you're experiencing any of these symptoms, I would recommend coming in and getting an evaluation. It'll start with x-rays and a physical exam and see if your symptoms match up to what hip osteoarthritis is. And from there, we can sit down and talk about all the treatment options, non-surgical and surgical including, and see where you are on that pathway and make a specific plan for each patient. Our joints are mechanical. Unfortunately, they wear out over time. If you have severe pain, that pain is usually coming from the loss of cartilage that happens throughout our lives. And then an inflammatory process occurs, and the patients many times will grow bone spurs. They may grow cysts within the head of the femur, which can be extremely painful. What I recommend surgically for patients with hip osteoarthritis, especially if it's end-stage osteoarthritis, is hip replacement surgery. Nowadays, joint replacement surgeries are just a resurfacing. They're a lot less invasive. We replace the diseased bone, the ball and socket portion of the hip, with metal and plastic that lasts somewhere between 15 to 20 years. So if after evaluation, if we decided you need a hip replacement, we'll pick a date together. Surgery will take about an hour. Afterwards, you'll be in the recovery room for a few hours. We can do it where you go home the same day or stay in the hospital. Really, the choice is up to the patient. It depends on their health. Before you go home, we'll have physical therapy work with you. Make sure it's safe, that you get up, get moving. But recovery usually takes about 3 to 4 months with the robot. And what I'd like you to know is that we're a team. We're going to walk through everything and discuss every option on the table together and make a decision together, and I'll be there every step of the way. The outcome that we're looking for is the ability to walk without pain, the ability to do the things that you want to do, run or jog, play sports, enjoy time with your grandkids, go to their games, be able to hike, be able to walk your dog, doing anything and everything you were doing before.